Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. I'm joined here with a great friend, Michelle Minton, who's the Managing Director of Drug Policy at the Reason Foundation. Hi, Michelle.
Hi, always good to see you, Brent.
And this is part 2 of a conversation that we had. You can catch part 1 if you go to gfn.tv. So, Michelle, let me ask you a powerful question right off the bat. Is there a war on nicotine in the U.S.?
In the U.S. and most parts of the world, yeah, there's clearly a concerted effort. You know, it depends on if you want to define war as people trying to eradicate something or at least smash it into submission. That has definitely been happening for a long time. I mean, it's hard to say this with Cop 11 just happening, but it's kind of cooled off a little bit in the United States, only in that the vaping industry has been crushed into submission for the most part. And now it's just the nice, acceptable large tobacco companies.
So crushed into submission. Now, I'm confused. Didn't President Trump promise to save vaping?
He might have. He makes a lot of promises, but that hasn't happened yet. As we've discussed, that his FDA is apparently creating a pilot program to fast track applications for nicotine pouches, but we haven't undone any of the horrible things that have been done to the vape market. 99% of that is still gone. There's still no opportunity for smaller companies to participate, to innovate, to have products approved in anything less than 5 years. None of that. I'm not sure what he might consider saving, but right now it's saved in that it's safe in the hands of a couple of large tobacco companies.
Michelle, in a recent article that you wrote for Reason, the FDA's plan to fast-track nicotine pouches is long overdue, but why aren't vapes included? What a great question. Why aren't vapes included?
Why didn't they start with vapes? Nothing against nicotine pouches. It's a great technology. Everything we've seen so far seems to indicate that they're one of the lowest risk alternatives, popular alternatives versus medicalized alternatives for cigarettes. However, there's just so much more data and scientific analysis and research and corporate research and analysis and clinical trials when it comes to e-cigarettes that it's kind of questionable why we would start with nicotine. I mean, I guess the one answer, and I've not heard anything from anybody in the administration or anywhere else to suggest this is the reason that they would even give, but the only thing I could maybe come up with is just that there's a little less controversy with nicotine pouches so far. If you think about the e-cigarette market, for example, you've got like however many vapor devices and however many pods of 2 to 3 strengths, and most of them have exactly the same ingredients. Maybe you have a few different flavors. There's no need for each individual company to study the effects of smoking cessation of all of their, of tobacco flavor at 3% or tobacco flavor at 1.5%, that kind of thing, versus what it seems like the FDA is going to do, which is allow the manufacturers to use category specific research on that one particular issue of smoking cessation or reduction. So if they can show that nicotine pouches generally, or nicotine pouches like the ones that they're trying to get approval for, if there's evidence that they lead to smoking cessation or reductions in smoking, then they can submit that instead of doing, their own clinical cohort trials or whatever, like long-term cohort trials or whatever they're going to be doing.
Isn't the biggest stumbling block, though, that FDA, Center for Tobacco Products, is holding the company's feet to the fire on the public health? Like, it must be appropriate for the
benefit, yes,
the benefit of public health. And that the FDA and CDC has said time and time again that really just comes down to you have to prove that flavors are not going to attract kids to use the vaping product. So are they not going to apply that same strict review to nicotine pouches? Is that really the key thing? Or this will be fast-tracked as long as we gloss over that issue?
I wish I could tell you, but we honestly have no idea. This information first became public, not through an announcement, but through leaked transcripts, then an announcement at the FDA, which did not provide very clear. And that is actually the biggest problem, which this fast tracking is not fixing, as far as I can see, which is that the FDA, when it comes to this process of approving new tobacco products, has pretty much given companies a whole list of the types of evidence that they could submit, but it doesn't tell them which or how many of them are sufficient to gain approval. So it's kind of just do as much as, I guess, and I'm stealing a line from Clive Bates here, do as much as you can afford and kind of hope that it's enough. do as much as you can afford, which is just, that's a just financial race there, which already weights it in favor of the largest, most financially well-off companies. But yeah, when it comes to the youth attraction issue, I think that gets into the population level effects. Honestly, I'm not sure what kind of evidence and what they're going to be looking for. We still don't even have a very good definition from the FDA about what for the protection of public health actually means.
They've issued a de facto flavor ban. That's what's happened. And if they got over the issue on flavors, we'd probably see a lot more products approved. You described today's vape market as a dystopian mix of a few authorized big tobacco products and a massive unauthorized market. So, I mean, has the FDA, are they getting what they were looking for with that kind of a mix?
Potentially, I honestly don't know what the FDA's final goal is. I do know that the FDA in other issues at other times has been fairly clear. For example, when it comes to food manufacture, that they prefer to regulate a small number of large corporations, that they don't want to regulate thousands and thousands of mom's cookie baking business out of her house. They don't want to have to deal with every, cookie baking mom in the country. They prefer to have just a few big companies. And that seems to be, whether it was the intent or not, that is the effect that tobacco law in the US, at least since the 1990s, has had. First with big tobacco, with cigarettes, and then with e-cigarettes, that dystopian mix. So what are the numbers, right? So I think at this point, from the estimates I've seen, it's hard to do these estimates because we're talking about illicit sales, but about 14% of the sales in the e-cigarette market in the US are from the FDA approved products. 14%. And then the rest of it is coming from unapproved products, which some of them are under review, of course. Some of them may, in 5, 10, 150 years, be approved, but almost 70% are coming from totally illicit, not under review, mostly made in China, illicit disposable vapes. Now, not that all of those are dangerous or anything, but they're not part of the FDA's review system. The FDA is functionally, we had a market that was unregulated prior to FDA regulation. Big market, thousands and thousands of small companies. And then the FDA started to regulate them, functionally wiped away 99% of those companies. Now the only companies that have e-cigarette products approved by the FDA are big tobacco brands. And you've taken 100% of the market that could have been legal and turned it into 70% that's absolutely illegal, completely unregulated, not being tracked, which would be a disaster were I the one kind of setting out to create. I was like, I want the FDA to regulate tobacco. This is the worst case scenario because you've just pushed legitimate businesses who would have maybe wanted to be regulated into the darkness where you have no idea where they're coming from, what's in them, who can be blamed if something goes wrong, how to track these products if there's some kind of problem in the product supply. It's a disastrous situation for public health from a regulatory efficiency standpoint.
In Canada, Health Canada's got standards, and to quote Clive Bates too as well, you don't need approval from the FDA to bring out a new beer, right? So it's not that it's a disaster, because many of the products that are for sale in the US that are called illegal are fully legal in Canada without approval, because it's a different system.
A standards and so this is one of those things that's very perplexing where you kind of start to get conspiracy brain where you're like, the goal is not what they're telling us the goal is, because for the FDA itself, and right now the FDA, Center for Tobacco Products, the people who work there, they don't write the laws. They don't have necessarily a lot of sway in which laws get passed, but they do have a lot of power in how those are implemented. And if you are the FDA and you look at the market and you say there are thousands of products, there could be thousands and thousands more if this keeps going, and we have to regulate this, a standard system where companies can tell you what's in them and then you know who they are and they register and they're complying with basic rules is a much easier way to go about that than having your however many dozens or hundreds of employees you have go application by application by application, specific, like case by case specifics. It's very energy intensive. It's very financially intensive. It's not good for the taxpayers. And that way we're like, they could be focusing their time on more important things than something that could very easily, I mean, I'm not a big fan of AI necessarily, but like computers, databases could kind of compare products and say, where are they different in their like chemical makeup or their like how they operate, where's the difference? That's what we need to look at. We already know this other stuff is safe or not safe.
So that brings me to a question for you, Michelle. Like, I mean, isn't it true that taxpayers don't pay for the regulation of tobacco products in the US? Isn't it funded by the industry?
At the Center for Tobacco Products in the FDA, their tobacco work is funded by user fees, which are the tobacco companies paying the FDA for the work of reviewing their PMTA. So on top of the joy of paying 20 to $100 million to submit your PM, just to construct one of these applications, you also have the luxury of then paying the FDA to do the work of spending 5 years to review your application.
That's unbelievable. Now, I mean, is part of the problem here is that the e-cigarette industry, like that independent vaping industry, there's no channel for them or ability really for them to fund that work. So nicotine pouches are mostly big tobacco business, right? So, and they, they're used to paying that agency hundreds of millions of dollars.
And again, there's no reason that, back when we had several thousand small companies, there is no reason that they wouldn't be able to pay the fees to have their applications reviewed, so long as that didn't cost $100 million. And it wouldn't have to, again, if we had a standards-based system like we do with alcohol in America. When you want to have a new alcohol product, you just kind of ask the federal government to look over your specs and like approve your label, not even approve your product, just approve the label, which you do need approved before you can sell it in the country, across state lines. But if the FDA had set it up as a system like that, review wouldn't cost that much money, and small mom and pop shops could feasibly afford those fees. And then the FDA would actually potentially have a much broader base of money, coming in for the Center for Tobacco Products, more money even potentially, and then they would maybe shake themselves free a little bit from the regulatory capture that most agencies seem to find themselves in when they're regulating big business, and when those big businesses have monopolies, duopolies, or they're kind of controlled by a few big corporations. Those big corporations are your lunch, so you kind of have a vested interest in them maintaining their status in the market.
Michelle, did the FDA effectively guarantee that only big tobacco could survive?
Yes, and that's why I said that I can't ascribe intent to agencies or even any individual there, but the effect is very clear. And people in the beginning, prior to any legislation passing, prior to the FDA having control over tobacco, when it was just being discussed, people were very aware that this would be the outcome, both in the industry and outside of the industry. That's why the legislation to give FDA control over tobacco was called the Marlboro Protection Act, because it would functionally shut out competitors, and even the smaller tobacco companies like Lorillard and it's hard to call RJ Reynolds a smaller company, but they were smaller than Philip Morris, for example. They cried foul because they observed that if these regulations passed, it would functionally just solidify Philip Morris's dominant position in the market by disallowing other companies to, one, enter the market, or to get new, innovative, competitive products on the market, and then three, to advertise their new brand or their new products to the people. Because if you don't know it exists, you're just going to keep on using the same product you've been using for decades.
Michelle, it's pretty laughable that every year millions of Americans join the ranks of vaping nicotine, most ditching smokes altogether, yet FDA fast-tracks pouches and continues to keep nicotine vapes in purgatory.
Yeah, I think the estimates now, there's about 20 to 25 million American users of e-cigarette products, and somewhere around 2% of the adult population have ever used nicotine pouches, maybe 2 or 3%, and then less than 1% are kind of daily users of pouches. Again, the technology is wonderful. It's a great alternative for smokers to have available to them. But when you're looking at e-cigarettes, just how popular they are in the rest of the world, that we have a global market for e-cigarettes, whereas we don't really quite yet have that for nicotine pouches. It's perplexing. It's confusing why they would choose this. And your dig about Tucker Carlson's product, you're not the first person to think that. We obviously don't have any evidence about this, but the decision making does not seem to be data-based, science-based. But again, if the FDA can enact this fast track pilot program, which people have been asking for over a decade now, with regard to e-cigarettes, but for any non-combustible new nicotine product, it would be great. It would be great. It would be wonderful if it could demonstrate that you can still approve products, they're still safe, you're still keeping an eye on the market, and then hopefully it would really it would make the case, it would make saying that we can't do that for e-cigarettes a lot harder to claim if you have a demonstrable, streamlined version for a different, nicotine product.
Michelle, it was in 2024 when then FDA Commissioner Robert Califf testified in Congress that tobacco harm reduction was an industry plot. And now at COP11, the WHO made that their key plank. Tobacco harm reduction is nothing more than a plot by the tobacco industry. What do you make of that?
I mean, it's the nothing more gets me. Is it a plot by the tobacco industry? I mean, in some ways, yeah, because they are profit motivated. They understand, they've been observing the declining smoking rates, and they want a product that they can sell as safer to their customers. So is it a plot? And they are putting their money behind advertising that and using the terms tobacco harm reduction, using the harm reduction language to sell their new product line. So in that way, sure, they're not wrong. And everybody is aware of the tobacco industry's kind of, let's say, questionable behavior of the past and their maybe dubious ethics of their past behavior. And everyone's now thanks to the public health community, very aware of the harms of smoking. So it's a very easy way to just kind of stick your finger into the lizard part of people's brain and poke the fear button, which is a way to get people to think a little less rationally, is what that is. When you trigger people's emotions, particularly fear, you are trying to get them to quiet the other more skeptical, rational parts of their brain so they don't think any farther than that. Obviously, I don't think it's a ploy in terms of, tobacco harm reduction being a ploy like emanating from big tobacco. And I know that because it was not big tobacco who came up with these products, who established the e-cigarette market. That was the mom and pop companies. That was consumers themselves tinkering and evolving products till they got to something that became popular. And then the large tobacco companies, seeing real competition, jumped into that market and functionally took that over with help from the FDA, of course.
Michelle, can you believe that youth smoking in the U.S. has collapsed to historic lows, but public health has barely acknowledged this as a success?
Yes. Yes, I can believe it. Because that's not success for them, right? Success for the public health complex, people in public health, people in government. The end of youth smoking is not their end. That's not where their goals end. So I believe that they're not happy about it.
Wasn't part of your work back then kind of drawing a line between the kind of the uptick in youth vaping as being something that was actually not just driven by fear, but it was actually a function of the communications and messaging and the marketing of the FDA and the real cost campaign and all that kind of stuff really served to actually energize the teen vaping epidemic?
Yeah, I think that was from my perverse psychology paper, and I was really digging into that because I noticed a trend, and I think we started to see it in the UK as well, where when the money flows into public health about this issue, whether it's vaping or nicotine pouches or any other substance that people are starting to get worried about, as the conversation gets louder and louder, in my paper, what I said is you're functionally telling youth everybody's doing it, but you shouldn't, which is exactly the wrong message that you send to children. But of course, that writing, those news articles, even the public health messaging that was supposedly aimed at youth wasn't really aimed at youth. It was aimed at their parents. It was aimed at adult voters to scare them about youth vaping. But the side effect of that was that they were marketing vaping. They were marketing it incredibly well, from what I understand about like marketing and psychology, in terms of how you communicate with youth to get them to actually listen to you. I watched tobacco control, particularly out in California, the California Department of Public Health creating cartoons and puppets and having young people talk to other young people. And those are exactly the things, yes, that will get the attention of youth. But what they were telling them in these ads is that it's everywhere. Everybody's doing it. All the cool kids, all the kids that, you wouldn't think them, they get straight A's. And these messages, I believe, were functionally advertising for this product, similar to the way that Dare educated an entire population of young kid about exactly what drugs look like, where to get them and what they did. And later research showed that it increased children's interest in those substances.
Let me ask you one last question about Bloomberg, and just to relate it to the WHO and tobacco control now have really hung their hat on tobacco industry interference. And they've said that anybody that's for tobacco harm reduction, anyone that's pro, say, for nicotine, we're just all working for the tobacco industry. And so that justifies, keeping us out. But, that's not necessarily the case, obviously. But how come there's no attention being paid to the interference from billionaires? How come they don't see that as influence?
I don't know, honestly. Why I don't think they don't see it. I think it's that there are too many people whose lives are built upon this model. And that if you start actually looking at philanthropic giving or even government grants as potential interference in whatever, like whether that's the scientific process or the public health conversation, if you start to deal with conflicts of interest there, it opens up a can of worms that kind of threatens everybody's lunch at that point, both the news, universities, NGOs, kind of everybody. And more importantly, I think there's just no desire, right? In this world, especially when it comes to politics, which public health is just politics, there's only an appetite to do something when there's a lot of money at stake. And that can mean a lot of things in terms of money at stake, but to do something here, the only people who want something to be done are the very, very ethical researchers out there, the ethical academics who are saying there's a lot of garbage studies being put out by government grants, or the individual consumers who are hearing their voices be drowned out by this kind of echo chamber. They're the only ones who are calling for some kind of change. There are no billionaires out there funding politicians to talk about that issue, because why would they do that? They can use their billions of dollars to influence things. And then the government doesn't want to do that either, because guess what? The government also wants to influence things through grants.
Right, right.
Like there's a reason that the FDA, when it wants studies on tobacco, or excuse me, the NIH, when they're putting out grants because they need the government at large needs data about e-cigarettes, for example, there's a reason that they word that grant proposal by saying, we want people to study the harms of, or this harm, or that harm, because the government is not particularly interested in the benefits of vaping. And partially that's because the reason they're asking people to study it is because they want to regulate it, and they want to have justifications for why they're going to regulate, how they're going to regulate. Usually it means control.
They want the research to back up what they already believe or intend to do.
And the same, of course, is true, with private industry. I think this is where you get why people don't see it, right? With private industry or private actors who are for profit, who are doing research on their for-profit products, you can see why they would want that research to make their product look as glowing as possible, or make their competitor's product look horrible. With the government, there is an ingrained belief, especially among Americans, and I'm sure a lot of other cultures in the West, that government is neutral. That, yeah, we have politics and we have presidents, but kind of the actual structures of government, the institutions that survive presidents, are not themselves political, that they are motivated by the public good. And we have lots of reasons to think that, but at the end of the day, the people who make up governments and the institutions that make up governments are people. And they have their own biases, interests, dogmas, crusades, and that in of itself, especially when it's unified across an agency or an entire government, that is influence.
I think it's a black and white assessment of motivation. So if there's a profit motive, it's bad. Any other motive is good.
Yeah, I guess Americans would be like, a study came out showing that when America invades another country in South America, it's good for everybody. And we would all just say, that's got to be objective research funded by the US military. We can see it there, kind of. If one of the military agencies put in a thing saying that, like, it's profitable for the American taxpayer, we would be like, well, you would say that. But it's harder to make that connection when you have an agency like the Center for Tobacco Products, which most people think is about safeguarding the market for consumers, right? Not necessarily getting rid of tobacco, but making sure what's available is safe-ish, or the safest options available for consumers. They don't necessarily think about the people at FDA Tobacco, even up to including the political appointees, having a political aim towards what they're doing. And unfortunately, that's just not the case.
Michelle, let's turn to a potentially more hopeful topic, and that is access to vaping products in U.S. prisons. Why is this an issue?
I mean, I have to really give credit and thanks to Jonathan Kirkpatrick's Filter article where he brought this up, because this is a known thing. People in the tobacco harm reduction space are very aware that marginalized identities, including people who are incarcerated, just have way higher tobacco rates. For people who are incarcerated, I think the estimates are somewhere around 70 to 80% of people in prison smoke. So that is about 7 times higher than the general population. That's a disaster. And there's lots of reasons why you can imagine. You have low income issues, you have family stability, housing issues that lead people both, not lead them to, but are both correlated with incarceration and smoking. And the real problem here, though, one of the problems is that people who are incarcerated, even if they would like to quit smoking, they don't have access to the full variety of tools that would be available to them to try, right? They pretty much just have, it depends on what's in the commissary in the prisons. That's what you have. If it's not cigarettes, if it's not a patch, then you might be out of luck, or you have to look for contraband, which a lot of people who are incarcerated do when it comes to finding substitutes.
Do some prisons ban vaping, but turn their cheek, allowing smoking?
That's what it seems like. So in the United States, anyway, most of our prisons now, I think federally, and then also in the States, most of them are tobacco free, which again, there's a certain cruelty here when you have people who are being locked up who have been smokers for some amount of time, and then one would hope that the commissaries have at least the medicalized alternatives like patch gum, whatever. But you are kind of trapping people in this situation where they're having withdrawal symptoms and other things that are happening while they're incarcerated. And cigarettes make their way in. That does not seem to be an issue for a lot of prisoners. It seems like if you want to have access, I mean, there is issues with that, right? Because once you have a contraband market, there's violence, there's coercion, there are a lot of problems. And then prison guards can use possession of tobacco to punish, to lengthen stays, to cut privileges like family visitation and things like that. So I think this article really highlighted that this is an incredibly underserved population in prison that neglected both from the academic and the like advocacy community, but it was also a perfect, and I don't like prison experimentation has a really dark history, so I don't want to say like, but it is a perfect, if it's voluntary, experimental population that you could give access to these products because it's all adults, so you don't have to worry about youth access. And then you could see how this works for people because we know when prisoners do quit, there's other programs to kind of help people with smoking in prison, but they're largely ineffective. And the evidence seems to show that about 98% of people who do quit while they're in prison relapse back to smoking once they're released. So if prisoners had available to them at affordable prices and some amount of variety, e-cigarettes, nicotine pouches, as well as the patch, the gum, that kind of thing, then we could see maybe the long-term quit rates improve. I'm sure the psychological improvement would be real, just because giving people the ability inside to solve one of their own medical issues is enormous. It's hard to imagine what it would be like to have a problem, to know what the solution is, and to have legally no way to have access to that solution.
Yeah, it would be empowering, wouldn't it?
A little bit, I would hope. It doesn't solve some of the larger problems. But, in the article, I mentioned that it would be a small measure of autonomy given back to people who are in prison, like allowing them because it's one of these things, the prisons, they're tobacco free. The reason they are tobacco free, why you can't legally purchase cigarettes in most commissaries, are because of the same groups that we were talking about, the same groups that go around trying to implement tobacco control policies, which is, okay, we could say maybe the effort is fine, but you can't just take one thing away and not give people access to other things. So it's that idea of the technocrats coming in with their solutions and then leaving an entire population of people to deal with the consequences. And so this would kind of restore, if someone's on the outside and they're a smoker and they want to quit, they have access to everything that's legal or not legal or unregulated in this country. Someone who's in prison has only what they can get at the commissary or non-legitimate means.
You've also been writing a lot on hemp in the U.S. What are the issues there?
It's another, it's an emerging market, right? Because hemp has been banned along with marijuana since the 1920s in the United States, but in 2018, I believe, the US Congress passed one of their budget bills, and what they did in it was they changed the definition of hemp to exclude hemp with, or they changed the definition of hemp so that what counted as hemp was had a certain amount of THC. Functionally, what it did was legalize hemp, which is the same plant as marijuana. They distinguished hemp from marijuana based on the level of THC. So it legalized hemp with low amounts of THC. And as entrepreneurs do, they acted on that. They saw a new market available to them because I have to tell you, this idea of hemp cannabinoids, so that's, intoxicating hemp products that are being sold like Delta 8 and things like that. The technology for converting non-intoxicating hemp plant stuff like CBD into THC products has been known for 30 years. It's not difficult. It's a known technology, but it never arose until recently. And my theory about why, obviously the legalization, obviously that's the big one. But the reason that it picked up in popularity among consumers is because they didn't have access to legal cannabis products. That what they wanted always from the beginning were intoxicating cannabis products. But because of the way it has been regulated in this country, the people in California, for example, there's I think 60% of the population in the state of California, like one of the biggest legal cannabis markets in America. They don't have access to legal dispensaries. They are more than an hour drive away from, because they're all concentrated in the big cities, and a lot of the counties in California have prohibited it. They're allowed to, local areas are allowed to say, well, we don't want cannabis shops in our area. So more than half of the population of California is not within driving distance of or they are within, they would have to drive a very long distance to get to a legal dispensary. Even in the places where they have dispensaries, again, partially because of the regulations that make things more expensive, the legal products they have access to are far more expensive than the illicit market products that have always never gone away. And in California, that's been a big problem where you have consumers who are like, well, why would I pay 5 times as much for a legal product with less variety here? And I could just stick with my normal dealer and keep doing that. But then when hemp cannabinoids became a thing and legal, right? So not banned, but not really regulated and legal, kind of that unregulated, not illegal. A lot of those same consumers who said, well, I can't access legal cannabis, but here's this other legal thing that does what I want it to do. And it's not my illicit, street dealer. I'll do this. So I think, again, kind of like with all of the other technologies, like hemp cannabinoid products like Delta 8 or like CBD, these are great products that I'm sure there are small populations that would benefit specifically from those versus other alternatives. But the vast majority of adults who use hemp products now would have just, well, okay, the ones who use intoxicating hemp products, they would have never really gone into that market in large numbers if they'd had access to legal marijuana at the end of the day. But what we now have happening, and this is where my mind gets blown and I get kind of depressed, in that I will go into a state and talk to lawmakers or regulators who have just finished, not finished, but are just getting through the process of legalizing marijuana and regulating it, and fighting their battles against more conservative voices in the state who say it should remain criminalized. We need to keep putting people in jail. And they fight and they say, no, that's a bad idea. We want people to have access to a legal, regulated marijuana market. And now here come hemp cannabinoids. And the same state, same lawmakers, same regulators have the instinct of, well, we have to ban this. Well, of course, we have to ban these products because they're unregulated and children are using them instead of regulate them and age gate them. So it's a little bit depressing that you have a lot of the states that just legalized cannabis or are like 10, 15 years into legalization are now trying to prohibit a product from the same plant. But the more interesting thing is you also have had a number of states, and they're almost exclusively the states that have chosen to maintain marijuana prohibition, have actively legalized hemp cannabinoids and are now defending, you have like a Rand Paul, for example, from Kentucky, who is one of the only members of Congress who was fighting the hemp ban that was just passed, unfortunately, last month.
So, Michelle, if you had a few minutes with President Trump and his FDA commissioner, what would you say?
Well, I'd have to think carefully so that I don't get myself on any more lists before I said something to them. But at the end of the day, what I would say is, look, every president since Taft has known that the drug war isn't a war on drugs. and I include nicotine here, and I also include vices here, but the war on people's behaviors that are considered vices is always a smokescreen to attack people. It's never been about anything other than that, but Trump is well aware of that. What I would say to him, to his face, would be it is very easy to tear things down. It is much harder to build something that works, right? And the tearing down of things can be helpful because sometimes in order to build something new, it takes a lot of effort to get rid of the old thing. But right now, I see a lot of tearing down and not a lot of building, even with this fast track issue, this fast track nicotine pouch approval process. That's wonderful, but the FDA needs to provide actual clarity that will outlast one administration in terms of things like what are the requirements for like what is sufficient for an application to sell a tobacco product, or what does the federal government, the FDA, consider for the protection of public health? What are you basing your decisions on? So I think that's probably what I would say, if anything.
And a final question for you, Michelle. What's next for you?
I mean, I plan to continue doing what I do, which is just seeing where my analysis can help when it comes to markets. I mean, mostly it's putting out fires, although I do hope it's putting out fires in terms of prohibition, where it seems like every day some state or city or country is considering the bright new idea of banning something as a solution to their problem. So it's a lot of that. But I am actually really looking forward to, and always have looked forward to, the building part of things and the creating regulatory systems and markets that actually work for everybody, not just one type of business, not just for businesses, but that work for consumers, that work for the people who live in the areas these markets operate in. And the worst part is I'm always waiting to get to that moment of building, because I don't actually think it's that difficult. I think we have the answers. It's more about finding the will.